Doctor, I want to start here because yesterday all we talked about was this lab-based study from Pfizer-BioNTech. Can you help us understand the difference between a lab-based study and a real-world study? How wide the gap is between the two?
Well, the lab studies are very informative and they're important. But at the end of the day, what really matters is what the real world data looks like, what we're seeing with infections, hospitalizations, serious disease. The Pfizer study was small, fewer than 50 people. It's lab-based data. It suggests good antibody responses to Omicron with the third dose boost in this small number of people. But there's other data that we're more excited about, like the fact that what we're seeing from South Africa is that many of the people hospitalized with Omicron are on room air and don't appear to be as gravely ill as people, for example, infected with Delta.
Dr. Beyrer, I've been asking for a couple of months now when we can transfer from a pandemic to something endemic, when the illness is not severe enough, whether because of immunizations or because of a variant that isn't as severe, to allow us to treat it like the cold. Are we getting close? Is Omicron close to that threshold?
Well, unfortunately, the world is in a serious Delta surge. So I think right now the answer is no. Infections are up in Europe, as you know, they're up here. We are approaching 800,000 American dead. We're going to pass that threshold in a few days. And we had 118,000 infections yesterday. Most of that, or almost all of it, is Delta. So I think the answer so far is no. It does appear that Omicron is more transmissible even than Delta. And if it is really true, and we'll know that in another week or two, that it's a milder disease, that may be something of a turning. But for right now, we're in the middle of a serious Delta surge.
Can you elaborate on that, this idea that if it is 4 or more times as transmissible as the Delta variant, as this one Japanese study showed, and it is less virulent, that it could cause herd immunity, and I hate to use this when it's Tom Keane's birthday, but herd immunity in a more efficient way. How realistic is that possibility among some of the healthcare professionals that you speak with?
Well, herd immunity has been elusive, unfortunately, Lisa. And one of the reasons why is because one of the things we've seen with Omicron that's concerning is that many of the people infected with Omicron have recovered from previous infections with coronavirus. So natural immunity does not appear to be that protective. What we really need to see, of course, is people getting their full immunization and then now clearly needing to be boosted. If you look at the total U.S. population, including children under 5, we're only at 61% fully immunized. So that is not enough to achieve herd immunity in this country, for sure.
When we look at the policy response to this in the public sector in the UK, for example, where they're putting in massive restrictions on the entire country, or the private sector here in the U.S., where you have Jeffrey saying work from home again, Lyft pushing their return to office date out into 2023. What is the appropriate policy response at this point in the pandemic, given how little we know?
Well, I have to say that I think the vaccine mandates are a very important part of this. And by the way, as I've said before to you all, they are constitutional, at least as far as the 1905 case that went to the Supreme Court in the case of a smallpox vaccine mandate, and it was determined to be constitutional. So I think the workplace employment mandate that President Biden has put forward is a really important policy step. In the meantime, we are in the middle of a Delta surge. We are seeing that related to the winter and the cold weather and people going inside. And that means that non-vaccine interventions like indoor mask mandates and people working from home are again going to be important. We know now the Omicron is here in 50 states. We're still very carefully following this to see if indeed it's going to be less virulent. But of course, in the middle of a Delta surge, we need to really practice the basics of control of coronavirus.